welcome back for a new episode of Doc Talk. I'm so happy to be here with you, and we have a special guest today, y'all. Let me run through our panel who's present. We got Major Dr. Michell Greenidge coming at you once again from an undisclosed location. We have Dr. Regina Parnell coming at you from St. Louis. We have Dr. Crystal DeBerry coming at you from Memphis, Tennessee. And I'm Dr. Jamaal Fortner coming at you from Houston, Texas. Today, our new face on the panel. Oh, wait, I'm sorry. Dr. Jason Lester, it's his birthday. Happy birthday, Dr. Lester, wherever you are. So he won't be here with us today. So again, let's move forward. Our guest today, Captain Dr. Brandon Withers, yay, coming at us all the way from Germany. Y'all, we had to do some work to make this happen, but it's all right. Dr. Withers, tell the people about yourself.
So, like you said, my name is Brandon Withers. I am originally from Arkansas, but I grew up in Alabama, a small town called, Jacksonville, Anniston, bigger cities near Oxford. I'm a psychiatrist, so I'm a medical doctor with a specialty in psychiatry, and currently active duty Air Force as well.
Awesome. Again, thank you as well for your service. We appreciate having some of our own out there hustling and working for these folks. So today we're going to be talking about Black health and the need for cultural competency. I want to just start off by asking, and we'll let our guest kick this off first. Why is cultural competency so important in healthcare?
Well, so I think from my standpoint, from a medical sort of perspective, I think it's important to really be able to reach your patients in a meaningful way. I think it's difficult to make appropriate and necessary medical recommendations without that cultural competence piece, because if I'm asking you or expecting you to make some lifestyle change, take a particular medication, it's hard for me to know what the potential pitfalls are, what considerations would be important, whether or not that's even something you're capable of doing. It's hard for me to know that without having that cultural competence to know what your sort of background is, to see if that's something you can implement and what things we might need to change to make that the most successful sort of trial that we can.
I like that. I think one of the things I would highlight out of your answer is just, can you even do this thing that I'm asking of you to do? I've seen a lot, especially in more in a medical setting, where doctors will give kind of a general answer to, well, how do you solve this problem? But when you look at the patient, they're just not capable of doing that. We've had patients where they have sat on the unit for 3 or 4 extra days because, well, their hemoglobin is low. Well, we'll give them a unit of blood is the first answer, but nobody ever bothers to ask first, are they willing to receive that unit of blood? Are they, Jehovah's Witness, or do they belong to a religious sect or just have a personal belief against it? And I think that it's so interesting that a lot of doctors never ask those questions before they jump straight to, oh, well, here's the answer. Like, why haven't you done this already? I mean, we all know, just give them a unit of blood. And the patient's sitting there going, no, I don't want your blood. Under no circumstances am I going to take this. But the doctor then has to go in and, be a little bit more creative maybe in their approach or try and figure out how to do something different. Ladies, I'm going to hop in. Do y'all have something there?
Yeah, absolutely. And I think this also kind of ties into what we talked about before when it comes to working with people of color. The important thing is knowing how to talk to people who are of a different background, right? Knowing what to listen for, what to expect, and things of that nature. And so, what would you say, Dr. Withers, regarding just in general, say, for instance, for those people who work with people of color who are Caucasian, maybe, what would you say is the biggest thing that they should look for when they're working with people of color?
I think really just being sort of open and understanding and being willing to sort of meet the person sort of wherever they are and not make assumptions about what that person's sort of capabilities, what their background, what their sort of access may be to various things. I remember, it's not necessarily medical, but hopefully it sort of illustrates my point. When I was in medical school, the day before I started medical school, I actually got in an accident with someone who happened to be an illegal alien, and my car got totaled. I ended up having to start medical school the next day without a car, and I bought that car with my own money, had to save up to get my very first car, which that car was. And so I didn't have a car for the first couple of years of medical school until I could save up to buy another one. And many of my classmates who happen to be Caucasian, many of them come from, double sort of, both of their parents were physicians in their household. And so money was not necessarily sort of a problem or a concern for them. So many of them, when they learned what my situation was just, oh, well, just have your parents buy you another car or go and, get a new one, as if it was just this simple matter of going to the dealership, picking one out and driving off. And me coming from a single parent household, like that was not an option, but none of them ever entertained the idea that I don't have the same capabilities that they do. I don't have the same access to money and resources that they do. And so their fix was not a practical fix for me because I could not do that, But very few of those people really sort of understood or took the time to really understand kind of where I was coming from and what my limitations were. And so I think in the medical field, we also sort of sometimes fall into that trap of, okay, you have this disorder, so you need this medication. We don't take into account this medication costs hundreds or thousands of dollars. And can this person actually afford that? Are you giving them a tool that they can use? Or are you sort of painting this fantasy that they can never actually achieve while ignoring some more reasonable options? Maybe it's not the best of the best, but it's the one thing that could help them that they can actually use. So go for the cheaper option if that can help, even if it doesn't, do the best job that, this $1,000 medication can. If that's what they can afford and something that they can actually get to, then that's better than nothing. Because if you tell them to go buy this $1,000 medication, they get to the pharmacy, they can't afford it, they're just going to leave and you won't see them again.
Right.
Right. I want to first thank you for being a part of our panel. Like Dr. Fortner said, we had to do a lot of adjustments to have you here. So I want to thank you for even just having your willingness to be a part. And we do have a connection because I attended University of Arkansas in Pine Bluff, so I have that Arkansas connection. But my question to you is, the HBCU. So my question, because I heard what you said, it was a struggle for you to maintain financially while you were in medical school, and others didn't understand the struggles that you were having outside of class. How can we as a community help support other young African Americans like yourself with the aspirations of being a medical doctor or even going to grad school? What can the community do to help support that idea for any of our children?
I think really the sort of willingness and really sort of making it known. I remember going through that process and it being sort of isolating just because I had no real sort of people to look up to as far as like people in my community being African American and going down that same pathway. I can't recall anyone in my local community or even further abroad like that I could sort of reference and someone I could reach out and talk to about the experience, and the rigors of sort of going through undergrad and then going through medical school, beyond the financial stuff, even just like how difficult this is, and having someone that can sort of understand and is willing to be supportive, having to rely, the financial piece was a big part because again, I couldn't rely on family for that. And so family friends became very important. And, fortunately I made good friends while I was there as well. But I think really sort of helping sort of steer them in the right direction and make that something that, is not as lofty an ambition. Even when I was younger and I said, okay, I want to be a doctor, many people just sort of dismissed it as like, oh, okay, you'll change your mind later. That's not going to happen. So eventually you'll sort of come down from the rafters and you'll find something that you can actually do. And, the closer you get, the more people start sort of believing in it. But along the way, it was sort of an uphill battle in this sort of proving ground of trying to show people how serious I was. And I think that that's part of the problem, is that we are just as capable as any other, color skinned person, any other race or cultured person. So to say that our lack of representation in this field is somehow innate in us, or that it's something that we even have to overcome, I think is a misstep. Like, we are just as capable as everyone else. So the only barriers we need to overcome are these sort of artificial manufactured barriers that are sort of imposed upon us. It's nothing sort of in us as a person. Like, we're all just as smart and just as capable as the next person, as the next white person. So really, those are the barriers that I think that we sort of really have to address. And if that means that we have to come together as a community and support each other in a different way, and not be, I think that culturally we are all sort of familiar with that kind of, I want you to do well, but like not better than me sort of mentality that we sometimes have, where you see the person next to you doing well and you get sort of, jealous, or, whatever that sort of reaction is internally, where, you're happy that they're doing well, but you sort of also wish that maybe you had done differently or done better yourself, or for your loved ones, or what have you. But I think that really just propelling those people forward, and not sort of allowing yourself to get stuck in that sort of mode to where you sort of hold them back from what they're fully capable of.
Yeah.
I was going to ask, the next thing I was actually going to ask was about how to improve that cultural competence, but I think you guys already kind of got that ball rolling. And one of them is, let's create more people who look like us to put into these positions in healthcare. I know here in Houston, the first doctor that I started going to here is an African American woman. And yes, I picked her because she is African American. And when I went to her, when I first started, she didn't have a huge clientele. Like, she had people who were coming, but it wasn't huge. But I noticed just the attention to detail that she gives. Yeah, I know sometimes like I'll wait a bit to see her, but it's worth the wait because she's going to give you the time that you need to actually explain what's wrong. And it's because of her, I know that she was able to diagnose a lot of things that my dad had going on, despite him having seen many doctors prior thereto who just never took the time to go deeper into the problem. And I really appreciate that about her. And I think that we do need to have more people who are willing to encourage kids to dream bigger. Dream bigger than what you can see around you. Because, hey, if we want better, we have to begin to cultivate that. I mean, there's no other way around it. We can't be stuck in old ways and old things that we've been doing. I want to ask what, well, because Dr. Withers is specialized in psychiatry specifically. I want to ask, do you think that our children, particularly African American children, are being overdiagnosed with any given diagnoses?
Yes.
Put him on the spot.
Well, yeah, I'm asking, because I know what I think I've seen, but I just want to know, from your point of view, do you think that our kids are being overdiagnosed with anything? And if so, what?
Yeah, so I think that they definitely are. I know that studies have certainly shown that when it comes to severe mental illness, especially, young Black, particularly males, tend to get overdiagnosed with severe mental illness like schizophrenia and bipolar disorder, as opposed to things like depression or anxiety, or things that are less severe. And they also tend to get very different treatment modalities when they get those diagnoses than people who are not of color. And that often reflects in different outcomes as well. As far as youth go, I would say the same is true. I think that we see a lot of young African American males and females being diagnosed with mental illness in general, when it's probably more a behavioral sort of concern and something that can be handled at a lower level in a different way. This sort of typical teen or preteen that's just sort of acting out at school. They're frustrated, rather than look for, this reasonable sort of source for that sort of change in behavior being, maybe there's trouble at home or trouble at school even. We'd rather sort of ascribe some sort of problem with the child themselves instead of looking in their environment, where that's usually oftentimes kind of the first place that we look. If they weren't of color, if a white kid is acting sort of out of order, then oftentimes it becomes the sort of primary concern is, okay, well, what's changed around them? What's changed in their environment that we can sort of maybe improve or change to sort of make the situation better, as opposed to looking at this as something is wrong with this child sort of in and of themselves.
Dr. Withers, you know what? You have touched on a lot of different topics in which, man, they could be, sessions in itself, right? But your first point of being open and understanding, I think that's really, really a great point, in that a lot of times clinicians who may not look like us, right? Sometimes they may try to treat the color of someone's skin instead of the environment, right? Instead of that person in the environment. That's the one thing I teach my students. Don't try to treat someone according to what you think their culture needs. Okay? We need to come from what's happening in the environment. Even when you're talking about resources, those classmates who were saying, hey, why don't you just get another car or have your parents buy you another car and things of that nature? It's just resources. Even if we have access to resources to receive help, there's so many barriers to that, even for the single mom. And we say, hey, you can go to WIC, but do you know all the rules and regulations in the WIC clinic? You can't eat. My first baby, I was unwed. And I remember sitting there for almost 7 hours. They say you can't bring food in, and I was a breastfeeding mom. 7 hours, even for public transportation, just to get there. Let's say I didn't have transportation. Riding the bus would have taken hours, getting there and then just, trying to go back home. And so I think a lot, again, when we're talking about cultural competency, making sure that we understand all of the different barriers on so many different levels, the macro down to the local, the micro, to just help our clients who don't look like us. I think that the treatment just needs to be individualized, period. Mm-hmm. Cultural competency to me is not even just a matter of that physical color, but just also making sure we individualize, because again, all of us are African Americans, but our experiences are different. Mm-hmm. I'm going to someone for mental health treatment for X, Y, and Z, while, Dr. Greenidge may go for another reason. That same clinician, I would hope, would not try to treat us as one. Mm-hmm. We're both going for different things. Our access to resources are going to look different. Again, when we're just speaking on resources, whether it's financial or just the social, the network, having that support social, like you said, to say, hey, to build us up, to continue on. When you were saying, hey, I'm going to be a doctor, but the naysayers, having those people in your circle. So cultural competency is on so many different levels for us. But when you say open and understanding, just making sure you're open and understanding to, one, the treatment does need to be individualized. Yes, I am Black, but I'm a Black woman and X, Y, and Z with 5 children, and I am married and X, Y, Z, and just making sure that that competence part comes in, knowing as a clinician, again, individualized treatment. I'm not treating this person according to their culture. I need to be aware of the systemic barriers, but it's more to it than that.
Mm-hmm. Right.
I definitely agree with that. I think oftentimes we do need to be more aware of the person in their system and their surroundings. However, I will always say, I will never be naive about the fact that largely medicine has become a machine. And it's like, it's not necessarily about the healing of the person so much as it's about how do we treat them, build them, and get them out the door so that we can get somebody else in his bed. And so when you have that type of, hey, profit loss type mentality, and that's always going to be first, seemingly in most healthcare settings. They're talking about bottom lines. So, they're going to be like, I don't have the time to have somebody come in and do a full biopsychosocial on a patient and then make a decision. Oftentimes, I've noticed even before a full biopsychosocial or something is done on a patient, a doctor's already gone in, seen them, decided what's wrong, and put in orders for how to fix it. And then it's like after you go in and you go, oh, wait, you can't go to outpatient treatment because you don't have a car. Oh, darn, doc, that ain't gonna work. And then it's like we're going backwards and now trying to fix what was fixed before we got there, And I think it's more like, hey, everybody needs to kind of slow down just a little bit, ask more questions, get a little bit deeper. Because it's like the benefits, I think one of the biggest benefits of having some type of cultural competence is simply that you don't have to redo what you've done already.
Because exactly. And I think
and so I truly believe in relationship building. And as clinicians, I think it's important for us to also train our clients on how to advocate for themselves. I especially do it with my family. When they go to the doctor, I say, first, you're sick, write out what's wrong with you. So when you go in there, you're not feeling so overwhelmed when the doctor come in there, and take notes. Because when you call me, I have no idea what you're trying to tell me because you've given me half of things that they've given you. So take notes. And you have the right to say, can you write that down for me? Explain that word to me. Gain an understanding before you walk out. It's okay for you to sit there. And when they say, is that all you need? No, I need an understanding because I have no idea of what you just said. I fell down a flight of stairs and I broke my ankle and I developed what they call CRPS. I had no idea what that was. And it's chronic regional pain syndromes, where your nerves are shooting fire and there's nothing that can be controlled. So when I went to the doctor and I'm telling them, I'm having these issues, I'm like, it feels like somebody's shocking me in my leg and I'm just, like I got a nervous twitch. He dismissed me quickly. But because I'm so strong in my will that I wouldn't leave. I'm like, no, I'm having these issues and you need to let me know what's going on with my body because I can't take this fire in my body. They wanted to medicate me. And that's so often what they want to do is give us these narcotics to help to shade the system. And if I would have took them narcotics, by now I would be hooked on drugs because they was giving them to me. He was so willingly wanting to give them to me. But I didn't want a drug. I wanted something else to help me mend the fire that was within my body. And so I was able to get an implant within me. But it's, if we don't advocate for ourselves, regardless of what doctor we go to, you might have the same outcome.
Dr. Withers, were you about to say something? I don't want to overlook.
Yeah, I'm actually drawing a blank now because it was to piggyback off of what you said. And then I had some thoughts on what Dr. Regina just said as well. So I'm trying to recall what I was going to say from your previous comment. I'm sorry.
That's all good. Just go with it.
I think that, she made a really great point. I often advocate for my patients, being this sort of, often I find myself being the bridge between the sort of mental health arena and the medical arena because I sort of wear both hats. I do a lot of therapy and I do medication management as well. And so I find myself sort of the go-to person for them when they don't get what they feel like they needed or wanted from their medical provider, their primary medical provider. They often come to me and sort of I end up being the one to explain what's going on or, fill in whatever holes may have been left or sometimes sort of make recommendations to them of, okay, go to your primary care physician and you can request X, Y, and Z thing, or here's some things for maybe them to consider that maybe they didn't consider at the time for whatever reason. This may sort of help you in a different, perhaps better way. And that often sort of has hopefully beneficial results from what we can tell. But I find myself in the same way with my family members. You know, they often call me with medical complaints and things, which I'm more than happy to take, except, you know, it becomes this sort of broken narrative that doesn't make a lot of sense cohesively. And then they have no idea. And oh, they gave me a shot of this, or they gave me this pill. And it's like, why would they give you that pill? Like, what's going on? Like, oh, I don't know. That's just what they gave me, and then they sent me home. And it's like it's your responsibility and your right to leave there knowing, you know, not as much as the doctor, but you should have an idea of what's going on and why you're doing this. You know, I remember seeing a patient when I was in medical school. I think I was in medical school, and this patient had had a hysterectomy and had no idea what that even meant. Like, when I told her, you know, after reviewing your chart, like this and this has happened, and, you know, here's why you're in sort of medical danger now, because she was having a positive pregnancy test after that, and that's kind of a big deal. And it could become life threatening rather quickly. And I'm trying to explain the gravity of the situation to her, and she's like, what did you just say? And I was like, you know, a hysterectomy, blah, blah, blah. And she's like, what does that mean? I was like, okay, that means they took out, you know, in her case, they had taken out the fallopian tubes and her uterus. And she was like, what are those? And I'm, you know, this is someone who had had multiple children, but had no idea like what these body parts are. And she's like, what did they do to me? You know, and I'm having to sit her down and draw models and all of this to try and explain what this is. And I'm sort of taken aback that you had no idea that you consented to this procedure. You know, I can see the consent form that you signed in your medical record. You consented to this procedure, and you had no idea what you were having done. And here we are some years after, and we're having this complication from that procedure, and you have no idea like where we even started, you know. And that's the sort of problem, that no one wants to take that time. And I think to go back to what Dr. Jamaal was saying, is that if you sort of approach this, you know, you talked about the kind of bottom line focused physicians, you know, like we all want to get compensated for the work that we do. And I don't think that there's anything wrong with that. But I think if you sort of leverage that sort of, you can do this right the first time. If you take a little bit more time now, you save yourself from doing twice as much work later. And that's how you sort of preserve the bottom line, is by really reaching this person and coming up with a workable plan the first time around, so we don't have to keep reworking the plan every time we find a stumbling block in the, you know, quick plan that you develop, that you sort of copy and paste to everyone that you see. You need to know when it won't work for this person or the next person, and why it won't work. There was another instance during residency training where one of the sort of child and adolescent psychiatrist fellows, she had made the recommendation to a family, oh, you just need to like change your son to an all plant-based diet, you know. And little did she know that this was a single mom with 3 kids who lived in, you know, not the best side of town, who could not, she fed her kids McDonald's because that's all she could afford. And so you telling her that she needs to go shop at, you know, these high-end, you know, all vegan and vegetarian sort of restaurants, and only buy, you know, fresh produce and all these things that are costly, and she has no means to do that, is not a workable plan for her. Now you're giving her that guilt of, I'm not doing what's right for my kids because I can't give you this all plant-based diet, when that's not the only solution for this child. It may not even be the best solution, but you're putting that on her to achieve this unachievable goal. And as a parent, like, that's not helpful if your goal is to try and make your kid better. Like, she's bringing the child to you to try and get help, and you're not providing that for her.
Definitely. I think it's interesting that so many doctors are like, I don't think a lot of doctors understand how they come across when they sit with patients. It comes across as very uncaring, because it's just like, I'm going to sit down, I'm going to tell you, I'm going to basically read a whole page from a diagnostic manual to you, and then I'm going to go, do you have any questions? Okay, and then they walk away. And I recently sat with my dad, and a doctor did that and was basically talking about serious like surgery, like, oh, we're just going to make a little cut and this is going to happen, but you could end up needing this, and this, and it might turn into a sternotomy. And then he just like stopped and was like, okay, so we're good. And I was like, we are not good, sir. We are not good at all. Because I can promise you, he didn't catch anything you just said.
Yes.
I want you to come back and give it to him one more time, and please make it understandable. Like, because you just talked about cutting his chest all the way open, from a small cut to cutting his chest all the way open, but you didn't say that. What you said was, it could just be a sternotomy, sir. So you basically gonna just cut the whole chest open. You might want to mention that and make it understandable, because that's unacceptable. Because, like, I feel like at this point you're almost being misleading and deceptive.
Correct. Even in dialysis, I noticed that a lot. Some people did not understand that dialysis is, for some, can be a lifelong prescription. They didn't realize. They were like, oh, well, how long do I have to be on this? And yes, for some, there's the difference between acute versus chronic. Acute, you may potentially regain function. But for a lot of them, they had no idea. Oh, I have to come to the clinic 3 times a week? Or how many hours? Oh, my doctor didn't tell me that part. It was just so sad. And it was a matter of, like you, Dr. Withers, I was put in the position of, okay, well, let me break this down to you medically. But then at the same time, I have to be, I have to show empathy, because I'm dealing with an episode of something that's just mind blowing at this point, because no one explained this to me before my first appointment, for someone sticking either a needle in my arm or the catheter right here in my chest.
Yeah. Yeah. And you know what, to add to that, on top of that as well, with providers who are not quite culturally competent being able to properly explain it in the first place. And I think one of the things that I hope that the viewers take away from this conversation is, for number one, for clinicians to be able to, it's okay to ask them questions. If you feel like they're not getting it, or you see that blank stare, that is an indication that they probably aren't understanding what's going on. So ask questions. You might even want to say something like, tell me about yourself. That's a thing. Actually act like you care. And I do get, just like Jamaal said, Dr. Jamaal said, oftentimes some clinicians get into this rotation, this schedule where it's like on to the next. But none of us got into this field to do that. You know what I mean? I get we need to make quotas and things of that nature, but it's very important. And I'll add to it that a lot of times for people of color, specifically African American people, we're not used to seeking medical attention in any capacity. So the medical world, therapy world, we're not used to it as a whole, right? So if we're coming, we're probably pretty scared, fearful that we're going to get some diagnosis that's going to make us worse and things of that nature. So it's going to be very important to take things slow. You know what I mean? And if you don't have time for that, refer to some place that has time for it. That's the fair and the right thing to do.
Yes, I spoke with someone the other day and they told me their doctor saw 92 patients in one day. Literally, what is it? Maybe 11 to 12 an hour. They don't have time to say, hey, how you doing? It's really in and out.
They don't have time to see their patient.
Exactly. It's just a matter of, all right, what's your symptoms? X, Y, and Z. And like Dr. Jamaal said, it's the profit and loss, when it comes to that. Profit and loss versus building rapport. It's almost like you need to choose.
And heaven help if you don't have insurance. And that's another thing. Viewers, get yourself some insurance, please. Stop coming in these hospitals with no insurance. They're not trying to see you. They're going to they'll put a Band-Aid on it and send you on your way. Get yourself some insurance. Almost every, and I think this is interesting that most people don't know this, almost every county, every town, every city, especially a larger city, has some type of indigent health program. Find out what it is and get yourself on it. Stop walking in the hospital and then getting mad because you ain't been there you sat in the waiting room for 32 hours, and then when they brought you in the back, the doctor saw that your heart had exploded, and all he did was give you a little Sprite and tell you to tap and see if you can get that gas to move and go on home. They're not trying to treat you. Get yourself some insurance, please. It is important. Also, if you live out in the middle of nowhere, you especially need insurance.
It's the middle of nowhere.
It's just the truth.
I think you bring up a good point, though. It's like, get the insurance, but how do I know that there's insurance for me, right? So one of the things that I will add to that is most of us, even the people that live out in the middle of nowhere, we get on the internet in some way, shape, or form. And we look up YouTube videos and we get on Facebook and we do IG and we TikTok, right? Learning the next one, right? If you can do all of that, you can learn how to get insurance. Okay. And so you don't have to tell someone or you don't have to wait for someone to tell you how to get the insurance. You can go and look for that yourself. You know what I mean? And so
I'm sorry, go ahead, Dr. Greenidge.
No, you're fine. That's the only point that I was going to make.
A lot of people will ask, especially for my population, I serve those affected by incarceration, and it's okay, so now what? Because my job doesn't offer health insurance, so what do I do next? There are marketplace navigators where it does not cost. The insurance company literally will pay them to help you find a plan, even if it is TennCare. And I'm saying TennCare because I'm in Tennessee, but some form of even Medicaid. And so I will refer my people, my clients, to my representative. A lot of people don't know that.
Yeah, and I was about to make the same point. There are representatives, but sometimes in areas, no one knows that there's a representative. So what I would express to individuals, everybody has somebody in their family that knows something. Yeah. Utilize that person that knows something. Sometimes we overuse them, but when you have that advocate for you, use that person so they can help you get what you need. Don't just sit there and not get the medical attention that you need, because something so small can save your life. I have a friend that's much younger than me. She had a massive stroke. All she needed to do was, she had the symptoms of the headache, and she kept eating wrong, but she just never sought out a medical profession. And if she would have went and got to the doctor, she could have got blood pressure pills, she could have, whatever they could have given her, could have prevented her from being partially paralyzed right now at the age of 40. So, when you're having these symptoms, don't just think they're going to magically go away. Seek out the attention, seek out somebody that can give you an understanding that's what's going on with you.
I think just to summarize some of the points that we've made, one of them being, seek out the help when you need it. Don't wait for Jesus to come sit on your bedside to decide to go to the doctor. Two, get yourself some coverage, whatever it is, be it like a local plan, a marketplace plan, get yourself some coverage, please. Always remember that you are like the expert on you. You know your body. So if something's wrong, don't let somebody tell you that nothing's wrong. You can't sleep at night. You feel like your head about to blow off. Please stay there. Stay in that hospital. Stay in that doctor's office until they give you the answer that you need and tell you how to fix what's wrong. Again, I want to thank our special guest coming to us all the way from Germany again, Captain Dr. Brandon Withers. And I want to give him the last word. Dr. Withers, what's something that you want to close out and let the people know?
I will close with like a few points, if I may. And so I just jotted some stuff down because I didn't want to forget. So I want to really emphasize that as a culture, as a people, we really need to not be afraid to go to the physician. I know that people, of all walks of life, no one wants to get bad news, right? And so if something hurts, something's going wrong, we all sort of jump to the worst case scenario, that one friend of a friend that we heard about, and it was like the worst thing in the world, right? They had cancer or whatever the thing was. Doesn't mean that's what you have, but that might mean that it is worth looking into. So if something is wrong, if something happens and you need to go and find care, go find care and get an answer. An answer will always be better than whatever it is you're making up in your head, because it's likely not going to be that bad. And if it ends up being that bad, at least then we can do something about it. I think on the subject of seeking out coverage and finding a healthcare plan or whatever you can get, talk to the HR rep or the patient advocate at whatever hospital or outpatient facility that you have. There should be someone there who can be a resource for you as well. Make yourself a problem that they have to deal with. You can ask questions of your clinician, of whoever works in the staff in that office, in that hospital, like make them help you. That's their job. And if they don't have time to do their job, then you either need to make them do their job or you go somewhere else and have them refer you to somewhere that has the time to treat you like the patient that you deserve to be treated like. And so, however that needs to happen, just make it happen. And also, I would challenge whoever is going to their physician, leave that office knowing how to describe what it is they just told you. Don't let them give you this spiel and you just sort of nod and then eventually you leave without having actually learned anything about what's going on with you, because they're going to give you a bunch of paper that's going to be harder to read than what they just said. So make sure that you have some idea when you leave there about what you want to do and what you're supposed to be doing, what your instructions are, how often you're supposed to take your medications, what your medications are, all of those things. Like, you should leave there knowing how to take care of yourself in whatever way that you agreed on with the physician as well. And yeah, I think that that's really sort of the most important things that I think we've kind of talked about at this point. So I hope that everyone sort of carries that forward.
Awesome. Thank you so much. And we will see y'all next week. And hopefully you're staying in good health. All right. See ya.